So this is X-ray soft tissue neck and nasopharynx lateral view. And what does this show? So let us see. This is a nasal cavity. So here comes the choana, and this part is the nasopharynx region. This is the hard palate, and here comes the soft palate. So this is the outline of the tongue. Sorry, this is the outline of the tongue. Let me erase the other parts. So you can make out the tongue, and this is the epiglottis, this is the hyoid. So notice there's a soft tissue shadow in the nasopharynx, and there's a crescentic hair shadow just behind this. So this is diagnostic of antrochoanal polyp. So antrochoanal polyp arises from the nasal cavity. Since the direction of the maxillary sinus is opening is posteriorly, this grows posteriorly and then prolapses into the nasopharynx, and if it is sufficiently large, it hangs behind the soft palate into the oropharynx region. So this patient can present with unilateral nasal obstruction. If it hangs into the oropharynx, it can present with bilateral nasal obstruction also. And if it is in the oropharynx, patient can have a plummy quality or hot potato voice also. This can be confirmed by doing a diagnostic nasal endoscopy, wherein you can see a polypoid mass in the middle meatus extending into the nasopharynx. So the polyp would be pale in color. Care should be taken not to confuse juvenile nasopharyngeal angiofibroma, in which case the polyp would be, the mass would be pinkish, fleshy mass in the posterior part of the nasal cavity, and it can extend into the nasopharynx and also oropharynx. CT scan may show extension into the pterygopalatine fossa and infratemporal fossa, and this would be contrast enhancing also. So this coming to this case particular, so once again I repeat, this is X-ray nasopharynx, soft tissue nasopharynx lateral view, showing a soft tissue lesion, soft tissue shadow in the nasopharynx hanging into the oropharynx with a crescentic air shadow. Probable diagnosis is antrochoanal polyp, the treatment of which would be functional endoscopic sinus surgery or FES.